Human sexuality is our most fundamental biological and social drive, yet it remains the single most difficult subject for humans to articulate out loud. We see the breakdown in specific, high-stakes moments. It happens when a couple navigates the physical changes of postpartum intimacy, or when a partner carries a hidden betrayal, or when an individual tries to voice a shifting gender identity. In these moments, a psychological defense mechanism takes over. The brain perceives the verbalization of sexual truth as a direct threat and responds by erecting an emotional wall. This creates a vacuum effect. When we fail to find the words, silence rushes in to fill the space. And in a relationship, that silence inevitably leads to isolation and shame. A sexual disconnect is rarely a failure of love or desire. It is a failure of our spoken vocabulary to safely process the weight of vulnerable trauma. Clinical interventions like Ronnie Burke's card decks, Let's Talk About Sex, and Free to Be Me are designed to work around these limitations of spoken language. They rely on the mechanism of psychological projection. By introducing a neutral, third object into the conversation, the brain can shift its focus away from internal defenses. This is particularly effective for hurdles like male performance anxiety. The crushing weight of expectation can make a verbal confession feel impossible, but this illustration of the worried man surrounded by phallic shapes makes the pressure visible. By pointing to the art and saying, "I feel exactly like this," the patient is relieved of the burden of having to say, "I am failing." The abstract image carries the truth for them. We see this bypass again in discussions about endurance or aging. This clock face, constructed of phallic symbols, provides a safe way to communicate the intersection of time and sexual pressure. These cards act as cognitive hacking tools. They allow patients to externalize their deepest insecurities onto a safe, non-judgmental piece of paper, rather than struggling to build them into a sentence. Watercolor art is uniquely suited for this work. Its soft, borderless nature makes harsh or visceral realities approachable and less intimidating. The cards provide a framework for navigating relational friction after major life shifts. This illustration of a couple in fetal positions highlights the physical separation that can occur after becoming parents. They also surface themes of hidden truths or withheld desires. Seeing the woman holding a finger to her lips behind her partner's back creates an opening to discuss secrecy. Visual tools are especially effective for communicating bodily shame, gender dysphoria, or physical pain. This tight framing of hands covering the pelvic region signifies a level of vulnerability that words often miss. The deck also explores diverse identities and structures, including sexual orientation and polyamory, as seen in this throuple illustration. The art is intentionally ambiguous. This prevents a therapist from leading the witness and forces the patient to project their own unique truth onto the canvas. By mapping the vast spectrum of human sexuality, the cards validate hidden experiences that many previously believed they were facing entirely alone. These decks function as a prosthetic vocabulary. They offer a communication bridge for individuals whose voices have been suppressed by trauma or a lack of emotional education. The process focuses on empowering individuals to connect with their unique identity, moving the therapeutic goal beyond the simple mechanics of a sexual problem. This physical resource, the Let's Talk About Sex deck, provides the foundation for that reconnection. For those who recognize a communication gap in their own lives, this new vocabulary is available at ronnieburke.online.